everyone, Jennifer here. Welcome to a fun segment of Bella TV. I am with Dr. Jeffrey Lynn of You MediSpa in Howell, New Jersey. Dr. Lynn, thank you for having us at your beautiful office.
Thank you for coming.
Of course. So let's get right into it. Tell us about your practice and some of the services that you offer. You offer absolutely everything here from Botox to filler to what you specialize in, which is vein treatment. But run us through some of the things that you offer here.
Sure. I run a MediSpa, which is partial medical. The other part is a spa-like setting. With the medical aspect, I offer vein treatments. For the spa segment, I offer hair restoration, hair removal, skin rejuvenation, IV hydration therapy, Botox, fillers, body contour.
So essentially a one-stop shop for absolutely everything that you need.
Yes, that's exactly right.
So walk me through a little bit, because I feel like this is one maybe beauty procedure treatment that a lot of people don't talk about, but a lot of people do suffer with, and that's the treatment of varicose veins. So I guess let's start by, how can you identify when it is a problem and when you think that you should get them treated?
Sure. So if a person is experiencing signs and symptoms such as pain, heaviness, fatigue, restlessness, and cramping, you might want to consider coming in for an evaluation for your veins. What we have here is that we can do an ultrasound scan and a consultation, and then we can let you know if you need further treatment.
Okay. And in addition to, obviously, the physical pain that goes along with the varicose veins, there can also be an appearance that obviously people are not pleased with, right? I mean, do you see more people that come in because they just want to improve their physical appearance as well? Like, you don't have to necessarily be in pain to get the veins treated.
That's correct to a certain extent.
Okay.
Insurance companies, as well as the medical aspect of it, involves signs, symptoms, and ultrasound scan findings. Let's say someone comes in and they just have varicose veins and no symptoms, then that's more of a cosmetic issue.
Okay.
If a person comes in and says that they have pain, heaviness, fatigue, and so forth and so on, as what I had previously mentioned, then you would want to consider it to be something medical that needs to be treated.
And so tell us a little bit about how you treat the veins, the downtime, what goes into the procedure, what people can kind of expect when they come in.
Sure, there's very little downtime. You can actually go back to work the same day if you have any of the procedures done, but the procedures involve what's called an ablation procedure.
Okay.
It's where you come in and everything's done in the office. You come into the procedure room, you will be prepped and draped, and I will use local anesthesia to access your vein. Once I access your vein, I will be inserting a catheter, and we will use heat to close down that bad vein so that the other veins work better to bring the blood back up from their feet and legs up towards the heart. Once the procedure is done, I will remove that catheter and you can drive yourself home. It's just 1 week of no heavy lifting, and you will have an ACE wrap around your leg that you'll wear for 24 hours. Thereafter, which you would change out to compression stockings, or you can reuse the ACE wrap.
Wow, so 1 week, that's virtually no downtime. Is this something that takes upkeep? Will people have to come back to see you? Could they see a reoccurrence of the veins, or is it in the office, one and done?
So there is a small percentage of patients who may have a recurrence, but it's very low. It's about 2 or 3%. For upkeep, we usually like to monitor at a 1 month point, a 6 month point, and then 1 year.
Okay. I mean, I think this is very interesting. I think a lot of women suffer with this but don't necessarily know that it's cause for treatment, or are just embarrassed about talking about it, physical imperfections on your legs and whatnot. So I think that's so interesting. In addition to all of the other services that you offer, you do have a special promotion going on now, right? If people want to come in and see you?
Yes. I mean, we have promotions on all our services right now, especially during the summer. So we want to make sure that people come in and leave happy.
All right, so if people want to get in touch with you about any of the treatments you've mentioned, especially the vein treatment, or just follow along in general, let us know your website, your social media handles, phone number.
Sure. Our website is www.newyoumedispa.com, and for social media, Instagram is You MediSpa Howell, and for Facebook, it's You MediSpa.
Perfect. Well, thank you so much for having us. Your office is absolutely beautiful. Make sure you give Dr. Lin a follow and visit his website for a consultation.
Thank you, Bella Magazine, for being here and doing this interview.
Of course.